Hello, my name is Tatiana, and right now I am going to be completing the abdominal skills checkoff assessment. So prior to entering the patient's room, I would have washed my hands, make sure to introduce myself, and we would be completing this exam after I've already done the systematic approach. So first, just looking, also I would like to state, unfortunately, my stethoscope is at work. So I will be using this yo-yo, and I will be indicating when I'm using the bell or diaphragm. Okay, so first I would be inspecting my patient's skin, noticing if I see any bulges on the abdomen that could indicate hernia, if I notice any abnormalities with moles or things like that, but this patient's skin is intact, so we're going to proceed to the next step. Okay, so now we are going to auscultate all 4 quadrants, and I would be using the diaphragm of the stethoscope, which is the yo-yo. Starting with the left quadrant, right now what I want to hear is just abnormal bowel sounds, which is some gurgling, every 5 to 10 seconds. Moving down to the left lower quadrant, right lower quadrant, right upper quadrant. Now, again, using the stethoscope, I'm going to be auscultating the descending aorta, starting about 2-4 inches above. Ideally, I do not want to hear any bruits during my assessment. That could indicate that there's some sort of constriction and more pressure going through. Next, I'm going to auscultate the bilateral renal arteries. To locate those, I'm using the umbilicus as a placeholder, moving 1 to 2 centimeters out, starting with the left. And I would be using, needed to switch over to the bell of my stethoscope. And then with the right, again, we're assessing to see if we notice any bruits or audible pulsations. Ideally, we do not hear those in a normally functioning renal arteries. Otherwise, that could indicate there is an increase in pressure or some sort of constriction. Now, moving to the iliac arteries. So again, umbilicus is our placeholder, but we're moving down about another 1 to 2 centimeters using the bell. Listening again for any bruits or audible pulsations. None heard. And then we would move down to the femoral arteries. Sorry, sir. And just gonna listen. Wonderful. So no bruits are heard. If they were, we could go ahead and palpate the arteries at this time, but this is thankfully a healthy male. Next, we're gonna move on to percussion. Move up just a... Now we will be percussing the patient's entire abdomen, making note of tympany or dullness. Tympanic sounds will be heard around areas that are just filled with gas. Dullness will be heard over areas that have an organ. Specifically, we'll be looking at the liver. Just going around. Okay, so now to find the liver, we're going to start patient's clavicle. Midclavicular line here. Okay. I'm going to start from the bottom up first. Here, starting to hear dullness around here, making note. Then we're going to start from the top. Got my little ruler here. About 10 centimeters, which is within the normal range of 6 to 12 centimeters. Now we're going to percuss around the spleen area. So we're going to be looking over here on the left lateral side of the patient's abdomen. So we're going to be counting to the 6th rib. Okay. All right, and then what we're going to do is Castell's point. So here on the intercostal space, I'm going to ask you to take a deep breath. All right, do it again. Sorry, we're going to keep percussing. Go ahead. Sound may remain resonant, which indicates no splenomegaly. Okay, now again, I'm going to palpate the entire abdomen, but lightly, and this will be due to the fact that I want to notice if any locations are causing pain in the patient or if I'm noticing any abnormal bulges. So, sir, are you feeling anything uncomfortable as I go ahead and lightly palpate?
No.
Wonderful. So next we're going to go to palpating the aorta, pretty much the abdominal aorta. So a normal abdominal aortic diameter should be about 2 to 5 centimeters. I'm not quite feeling it in this patient, but this will be the normal location. Okay, and then I would go into a deeper palpation on normal exam, but I'm purposely not pressing too hard to save patients some uncomfortableness. All right, next to palpate the liver, we already did our percussion, now we're on to palpation. I'm going to have my hand go in the back here, feeling for the lower ribs, about the 11th and 12th rib here. And I'm going to pull up while I am pushing in with my right hand's fingers facing up towards the head of the patient. All right, sir, I'm going to have you take a deep breath in. Okay, so while I do that, breathe out. All right, I felt it a little bit right over here, just the edge of the bottom of the liver. Okay, next we're going to palpate the spleen. So to do that, we're going to be facing over here more towards the left side. Thank you, sir. Yep, good job. All right, so we're going to place hand underneath again, costal margin. Okay, and then place my hand here on the anterior spot. Okay, go ahead, take a deep breath. Breathe out. Okay, one more time, breathe in. Breathe out. Okay, I'm not really feeling anything at this time, but it is quite normal for the spleen to not be palpable. Next, we're going to attempt to palpate the kidneys. So to do that, I will be placing my hand on the patient's, or left hand on the patient's left flank towards the 12th rib. And elevate. Take a deep breath. Okay, breathe out. All right, let's do it on the other side. I'm not really feeling anything, but again, that is normal. Deep breath in. Out. Okay, nothing felt. Good pause. Next, we're going to be assessing for Murphy's sign. Murphy's sign is used to indicate, we use that test to see if there's any gallbladder inflammation that could indicate cholecystitis. So we would be placing hands on the right side because the gallbladder is right behind the liver. So right here's my costal margin. All right, so sir, I'm gonna have you take a deep breath in and I'm gonna push in with my hands. Okay, go ahead. Any pain?
No.
Okay, if there was pain, that'd be a positive Murphy sign, but there's no pain, so we're gonna move on to McBurney's sign. So for the McBurney sign, we're looking down here on that right lower quadrant where the appendix is. We're gonna first use our umbilicus as a point marker and then the iliac crest, ticklish, right here. Then pretend there's a diagonal line. Boom, right here in the middle is where we're going to be assessing for. So I'm just going to palpate this point. Any pain, sir?
No.
Okay, so that would be a negative McBurney's test. Positive one would be that it elicited pain. Next, we're going to be doing the Rovsing sign. Again, another test we do to test if someone has appendicitis. Now, even though the appendix is located on the right lower quadrant, we're going to be focusing on the left lower quadrant here to see if there's any referred pain. So I'm just going to press deeply. Any pain, sir?
No.
Wonderful. So that's a negative test. Next, for the iliopsoas sign, I am going to be focusing on the knee. I know this is a weird angle for the camera, sir. Thank you. Alrighty. So I'm just going to put my hand above the knee. Okay, and I want you to raise your knee and while I'm giving you resistance. Wonderful. Any pain?
No.
All right, let's do it on the other side. Go ahead. Any pain?
No.
Okay, great. So that's a negative iliopsoas test. Okay, next to, we're going to keep working with your legs, but this time right leg. I want you to flex it. Bend your knee. Wonderful. Okay. All right, so now what I want you to do is I'm going to help you. I'm just going to kind of rotate the knee in. Any pain?
No.
All right, lay your leg down. So that was what's called the obturator sign, and if it did elicit pain, that'd be positive for appendicitis. Next, we're going to test for any rebound tenderness in that right lower quadrant. To do that, I'm going to just press in quickly and release. Any pain?
No.
Wonderful. Okay, great. Next, we're going to be assessing the patient's abdominal muscles for any umbilical hernias. One way to do that is to have patient get up into a sitting position without using their hands or arms. Let me just remove my stethoscope. All right, go ahead, sir. Wonderful. Now I'm just going to have you stand to view your abdomen. Okay. Now I want you to bear down and cough if you need to. I'm just going to see if anything pokes out. Big cough. Good. No bulging or any abnormalities noted. All right, now we're going to assess for the costrovertebral angle if there's any tenderness. You can see the line here at the end. Any tenderness upon palpation?
No.
Okay, any tenderness?
No.
Okay, that completes the abdominal portion of the exam. Okay, moving on to the next part of the exam will be the musculoskeletal assessment. Again, I would have already washed my hands before going in, introduced myself to the patient, and we already would have gone through the whole systemic approach prior to this. So to start, we're going to be assessing patient's motor function. Okay, sir, we're going to start with your neck, okay? I would like you to first bring chin to chest. Great, bring back of the head, look up. Wonderful. Do a rotation. Thank you. And then to complete, I would like, you can, normal, thank you, alignment. You're going to do right ear to right shoulder, left ear to left shoulder. Okay, patient had normal movement assessed, and we would do TMJ assessment, the mandibular jaw assessment, but right now we already did complete that at a previous assessment. Moving on, we are going to look at your upper extremities, so your shoulders, elbows, wrists, and fingers. Okay, so first, I'm just going to ask you, do you have any tenderness or any prior history to your upper extremities?
Lower back count?
No.
Okay. No.
Okay. So I'm just going to be assessing patient passively to see if I feel any crepitus here. Okay, we're going to start with your shoulders. Okay, you can stand up, please. All right, bring arms out. Wonderful, bring them down. We're gonna now go back. Good. You're gonna bring them out and away from you. Okay, bring them back down. And then take your right arm, bring it over. Wonderful, and then do the same on the left arm. Okay, full range of motion is noted. Next, we're gonna do elbows. Okay, so we're gonna bring them up to flexion and then extend again. Wonderful, then I would like you to hold your elbows out in front of you. Palms face up, palms face down. Wonderful. Okay, next our wrist. Okay, hold your arms up, flex, extend, again, in and out. Beautiful. Okay, next for your fingers, fist and open, fist again. Great. I'm just going to look at your fingers. We're going to assess the metacarpopharyngeal joints. It's important to do this to make sure a patient doesn't have any signs of arthritis, no bulges at the knuckle area. Good. All right, now we're going to be testing for your upper extremity strength, starting with your shoulders. I want you to try to bring them away while I am putting resistance. Go ahead. Good. And now try to bring them back down. Good. 5 out of 5 muscle tone for strength for shoulders. Next, we're going to do elbows. Bring them up. Good. Down. Good. All right. Next is for your fingers. Go ahead and open. Wonderful. Good. Okay. So now we're going to do the Tinel and Fallon test. Okay, so the Tinel test is something, well, both of these are used to assess if there's any carpal tunnel. So first, doing our Tinel, I'm going to have you just hold out your hand face up. Thank you. Starting from the index finger, tapping, let me know if you feel any pain.
No.
You stop here at the elbow. Next, starting at the index finger, tap. Stop here, any pain? Good. And next for the Fallon's test, I want you to hold this for about 30 seconds. Nope, full flexion. Thank you. The reason we're doing this is to see if patient can maintain this position without saying that they're in any pain or discomfort.
No.
30 seconds have passed. Wonderful. Okay, now I'm going to have you lie down, sir. Okay, again, now we're going to move on to your lower extremities. Is there any injuries or tenderness?
Lower back.
Your lower back, okay. All right, wonderful. So first I'm just going to palpate your joints. So we got our hip muscles, hip joint, our knees, not your kneecap it is, ankles, good, toesies, wonderful. Okay, so now let's get moving. All right, so we're going to start with hip flexion. So that's bringing your knees up. Good. Relax. Good. Wonderful. Now can you lift your legs straight up and then tilt it inward? Internal rotation. Great. Tilt it outward. Very good. Flexible. Okay, next one. Up. And out. Great. Oh, okay. Very good. Okay, now for knee. We're going to flex, bring up. Good. Extend. All right, some popping hearing, but okay. Go ahead. Next, left. And extend. Oh, big pop. Okay, next is ankle. All right, so I want you to be able to lift up, point down like you're, are we getting that on camera? Hold on, sorry. Up, down. All right, can you torque them internally? Good. External. Rotate. Good job. All right, so next what we're going to do is be assessing for strength. Let me see if we can just get your full body in there. It's a tall guy. Yeah, that works. Okay, so I want you to, for starting with your hip, remember how you lifted your leg up? Go ahead. I'm going to just press resistance. Up, up. Yep, straight up. Leg straight, lift up.
Oh.
Great job. Yep, very strong. 5 out of 5. Let's do internal rotation. Remember how you cross your leg in? Yeah, either one. You can start with either one, but bring it in. I'm going to be pushing out. Bring it in. Yep. Good. And now out. Good job. Okay. Next one. In. Yep. And then out. Good. Very good. 6 out of 5, honestly. Okay. Knees. Remember, we're going to make that, we're going like this. Okay, go ahead. Yep. Good. 5 out of 5. Next. Yep. 5 out of 5. Oh, good cracks. Okay. Ankle. So we're just going inversion, eversion. See? So go ahead, try to push it at me in. Good. 5 out of 5. Okay, out. Great, 5 out of 5. Okay, and then let me just see your toes. Can you curl them? Curl them out. Good. Wonderful. Okay. We're gonna have you stand up now, please. Oh, sorry, hold on. Now we're moving on to the back. All right, what I want you to, actually you're gonna stay laying on your back. We're gonna do the Thomas test first. So what I want you to do is to lift up your leg, bring your knee all the way like in like this, just one at a time.
Holding on to it?
Yep, go ahead, bring it up. What we're looking for here in the Thomas test is that the patient's able to do that without having to bend or move their opposite leg. So you just did that for the left side, do it for the right. Wonderful, so patient passed the Thomas test. Okay, so now we're just gonna be assessing for any knee bulges, if there's any liquid or anything that starts moving around in the knee area. So we're going to kind of just massage down, then come out from the lateral side. Nothing. Over here, massage down, lateral side. Knees appear normal. Okay, next we're going to be doing the valgus varus stress test. Okay, one moment. Okay, so now we're going to the medial collateral ligament assessment. To assess that, we're going to be doing the vagus or vagus test, not sure how it's pronounced. So what I'm going to do is be down here. We want to keep patients' leg straight, but I'm going to be pushing in here and seeing if there's any gapping noted, if there's, which would indicate that there is excessive stretch to that ligament. Thankfully, this patient's ligaments seem to be nice and taut. Okay, wonderful. Okay, next is the meniscus assessment. To assess that, we're going to be doing the McMurray's test. All right, so I'm going to hold 1 second, let me get patient in a better position. Okay, so now we're going to be doing the McMurray's test. This helps to assess if there's any problem with the meniscus. Please uncross your legs, sir. Okay, so I will be having you kind of bend your leg here, bend your knee, thank you. I'm going to hold the heel, and I'm going to, by holding the heel here, I'm twisting out like this. Keep your hip neutral, please. And then we're just going to be pushing in, and we're lower, and then bend up. We're just noticing if we hear any pops or clicks. No pops or clicks noted. I need to complete that assessment on the opposite side. Okay, and the final assessment for our knee portion is to test out the ACL and the PCL. Okay, so to again make sure that there is no over flexibility, over, it's too loosey-goosey on the ligaments here. So this is called the drawer test. I'm going to have the patient bend their knee, have their feet planted against, and then probably a little too much. Let me get my hands on here. Thank you. Have my hands behind the knee. I'm pulling towards me to see if there's any movement in the knee, and then I'm pushing. Then there's no movement noted. So thankfully, patients' ligaments are all attached. Their ACL and PCL are as they should be. Okay, I'm now going to be palpating the spinous process, starting from the cervical all the way down to the lumbar and thoracic region. Okay, or sacral, I should say. Okay, and now we're going to go and do the bilateral paraspinous. So just on the outside of the spine. Alright, now sir, I'm going to have you stand up. So we will be careful since patient did tell us they have some lower back pain, but I'm going to have you just on your side, please. I would like you, as comfortable, don't hurt yourself, but to bend at the hip. Yeah, good. And now you're going to extend like this. Wonderful. Okay. And now we're going to just assess if you, for scoliosis, before we do for scoliosis, just face the wall. I want you to do lateral bending, so. Wonderful, and then the other side. All right, and then I'm gonna have you assess for scoliosis, so face the window. You're gonna bend down. So it's important for the person observing to be at eye level with the back. I am assessing, and the patient thankfully does have normal curvature of the spine. All right, and that completes our exam.